move to the next presentation.
Let's move on to the next presentation. The speaker is Professor Hayashi.
Thank you, Chair. Good afternoon, everyone. I am Motoya Hayashi from Hokkaido University. Before, I was a member of National Institute of Public Health in the Ministry of Labor Health and Welfare in Japan. I'm going to introduce countermeasures against COVID-19 infection in buildings, especially about aerosol infection. The contents are countermeasures by Japanese government and the investigation results on indoor environments of cluster cases in Japan. In the last part, I would like to refer to the importance of balancing energy saving and infection control. First, I have to introduce the state of indoor environment in Japanese buildings. The left figure shows the maintenance system to keep good indoor environment based on the law for building environment and health in Japan. The right figure shows the non-conformity rate in buildings where the indoor environments do not meet the standard of this law. The table shows the standard of this law in the left figure. For example, the standard value of CO2 concentration is 1000 ppm, as you know. The rates of temperature, humidity, and carbon dioxide have been increasing since 2000. We think that the reason are energy and cost saving and the change of outside conditions, too hot summer and increase of carbon dioxide content in the world. And next, I have to show a basic problem in Japanese houses. We think that cold, hot, and polluted indoor environment has caused health influence of residents as shown in these figures. The left figure shows mechanisms of indoor air pollution in detached houses. And the right figure shows the influence of temperature, ambient temperature upon the death in Japan. Therefore, we are investigating the influence of indoor air environment upon our health in order to improve housing environment as shown in the figure. The figure shows our project to improve housing. So I would like to show about the countermeasures by the Japanese government. I have joined government's countermeasures committees since February 2020 as a researcher on building environment and health influence. At the first discussion, we investigated the factors of cluster infection in a houseboat, a sport gym, and a temporary space in snow festival at Sapporo, and so on. We recognized that these spaces were poorly ventilated and humid, and concluded that poor ventilation is an important factor of COVID-19 outbreaks. Soon after the first discussion, on 9 March, the government used the word 3C for the first time in the world. It means closed spaces with poor ventilation, crowded spaces, and close contact settings. On 30 March, the government showed the ventilation method according to the law for building environment and health. Although the infectiousness cannot be measured, we thought that a ventilation rate at least 30 cubic meter per hour per person is required, and opening windows was recommended. And before the summer of 2020, we investigated countermeasures in summer. We were afraid of heat stroke and other infections, for example, by infection transmitted by mosquitoes. The government showed a method to prevent heat stroke in COVID-19 pandemic, like this figure. The room must be well ventilated, and at the same time, the use of air conditioners and air cleaners were recommended. Before winter, the government showed the countermeasures in winter. We discussed ventilation methods of keeping indoor thermal condition in order to prevent influence opening windows upon health in winter. This is because indoor coldness is one of the large risk factors in residents' health. So gravity ventilation using one side opening and heating near windows were recommended. The infection routes have been discussed by experts of the committee for these 3 years, also in Japan. In July 2020, microdroplet infection was used by Advisory Board on COVID-19 Control of Japanese government. In March 2022, aerosol infection was used by National Institute of Infectious Disease in Japan. In July 2022, the latest notification was shown on aerosol infection. 2 types of indoor aerosol infection were shown. A is infection caused by large aerosol on air current. B is infection caused by small floating aerosol diffusion. So measures against 2 aerosol infection types are required. For A, physical distance and preventing steady airflow are necessary. For B, ventilation and CO2 monitors are necessary. Because we cannot measure the risks of A or B, we needed these 2 measures. The setting method of partitions not to block airflow was also recommended in this time. Then, I would like to show the investigation results on the on indoor environment. It is very difficult to propose the mechanisms of indoor aerosol infections. So I would like to show the measured results on indoor condition of cluster cases. We visited cluster sites and measured ventilation rates and aerosol movements using several measuring items like this. I would like to show some important cases. This table shows about hospitals where cluster occurred. For example, in Hospital A, over 300 people were infected in winter. The airflow rates decreased to under 30% of the designed value. And we recognize poor ventilation caused by aging, poor maintenance, and incorrect operation of air conditioning and ventilation system in these cases. It is about Hospital A2. Another high flow was used in a poor ventilated treatment room for a week. The virus expanded from this room to a whole world with hospital staff. And in multi-bed rooms with poor ventilation, many patients were infected. Aerosol moved from rooms to other spaces. This figure shows the measurement results of air movement. It could not be ignored that the movements of aerosol influenced the cluster infection. The infection risks were calculated using the measurement results. In this case, we concluded that poor ventilation and the incorrect use of nasal high flow made the infection risk from 2 to 150 times. These investigations showed that poor ventilation influenced cluster infections in hospitals. In July 2021, the government showed the administrative liaison. The following case was very important to investigate indoor aerosol infection. In 2 ice arenas in Hokkaido, large clusters occurred. In the first case, ice hockey players infected other players in the poor ventilated space on the ice rink. Cold air stagnates on the ice rink and stays long. So much aerosol with virus floats in the poor ventilated cold space on the ice rink. In the second case, players infected spectators. The measured air movements and PCR analysis showed infectiousness of aerosol with virus in ice arenas. So we used countermeasure funds to prevent the air movement from the rink to audience. The following case was also very important. In many call centers, clusters occurred. Too many members of staff talking for a long time in these spaces. Even if masks and partitions were used, they were under high infection risk. in this case, steady airflow in a poor ventilated space with uncertain CO2 control caused aerosol infection. This is the first infected, and secondly, they are infected. Maybe this fan moves aerosol from they to them. And thirdly, many people are infected. So steady airflow is one of the reasons of this cluster. Finally, I would like to talk about post-COVID-19. Energy consumption has increased in these 3 years. On the other hand, it has been pointed out that global warming increases pandemic risks. Therefore, effective methods to control both energy and infection will be more important in the age post-COVID-19. This is our conclusion. I hope that we will make use of this experience with COVID-19 and prepare the more effective countermeasures before the next pandemic. Thank you for attention. Thank you very much.
Thank you. Thank you for your nice presentation. Any question or comments from the audience? Please.
So my question is about how much of this is really attributable to one of those 3 C's that you mentioned, which is close contact. I'm thinking of the example you gave of the ice hockey arena. When you're playing ice hockey, you get very close to other people, breathe heavily on them. And that's almost certainly how people got infected rather than it being something that got transmitted across the ice in the air, is that close contact part. So I'm wondering, do you have any comments on that and how close contact might be considered in these other situations also?
You mean about
接触感染ではがないか考えられないかという。
Yes.
濃厚接触ということ。
Infection routes were investigated by medical researchers, and they analyze infection between players to players was caused by contact, but infection from players to audience, maybe aerosol infection. Thank you.
It's okay. Thank you. And another question? Use the mic.
That doesn't necessarily make any sense either. You just might have more than one people who are infected, especially if they come from the same family and the parent is watching their child try out. I mean, there's another issue too, is we shouldn't really get hung up on super spreading events because they don't really matter that much. They don't affect the overall transmission in a population. It's Julia Gogg's work at Cambridge, which has gone through this in quite some detail. In fact, we knew about this even before the COVID-19 pandemic. It's more of a comment than a question.
I think you may need to repeat it a bit slowly. More, please, Ben, you're speaking very fast here. I know you're passionate, but...
Sorry, please.
I think I have, I'd like to see the paper because I'm very skeptical. It's like peeing in a swimming pool. You're just not going to see it's an enormous space. And if you've got one infector in there, you're not going to, the transmission is not going to be particularly long range. The second point is super spreading events aren't that important in the grand scheme of things. We know that they do not affect overall transmission in a population. And Julia Gogg's work at Cambridge is a good demonstration of this. Sorry, that was more of a comment
コメントで
than
す
a
けど、
question,
今
but I
は
would like to see the paper if it is publicly available, please.
まだペーパーはできてないですね。このリングに関して興味があって、公式な論文があればぜひ読ませてもらいたいとおっしゃってますので。
Okay, we are making paper about this cluster infection, but not yet accepted.
Okay. Thank you very much for your response.
Thank you.
Thank you.
Okay.